Hello, 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 and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. For those of you who don't know me, I am Dr. Latoya Wells, Doctor of Nursing Practice, owner of Wells Legacy Health and Wellness. I am a family nurse practitioner. We are a full service family practice where we service all of your healthcare needs. We're located at 542 Osceola Street in Altamont Springs, Florida. You can reach us at 321-306-6755. And you can also look us up on the internet. Our website is wellslegacyhealth.com. You can find us on social media, all of the platforms. We're on Twitter, we're on Instagram, we're on Facebook, we're on TikTok, we're also on YouTube. So if you have not had an opportunity to subscribe to our channel, and turn those notifications on so you're notified when we drop a new video or a new episode, go ahead over and follow us. Thank you for those of you who have already subscribed to the page. Help us get our numbers up. Like and share the page. Invite people to the pages and to our social media platforms because the information that we have is so important. So welcome again to another episode of Wellness Wednesday. We are going to continue our discussion tonight on men's health. Last week, we talked about Movember, or earlier in the month, we talked about Movember. And Movember is a movement that was created to highlight all things men's health, specifically men's cancer or cancer screening, the importance of it, and also mental health for men. So we talked about testicular cancer screening and prostate cancer screening, as well as screening for mental health and what to look for. Tonight, we're going to continue in that vein, but we're going to go over some additional topics related to men's health. Men's health is often overlooked, and we talked about that. Men usually are providers in the home. They're, working hard. They're doing what they do, and many times they don't put their health as top priority. Or they don't feel anything going on, so they don't think there's any problem, and so they just continue with life. And it's important that not just men, but everyone takes control of their health, no matter what age they are. Men tend to have health issues just as women do. Women are just a little more proactive when it comes to their health. So tonight we're going to be covering some important topics like wellness, necessary screenings, hormonal issues affecting men, and key warning signs to be aware of when it comes to our men and their health. I love statistics, so we're going to throw out some statistics. Men on average live 5 less years than women. With men's life expectancy being about 76 years, we're seeing those numbers increasing in certain population. In terms of women, compared, their life expectancy is 81 years of age. And so according to the Center for Disease Control, the CDC, men tend to avoid regular doctor's visits, as we talked about, and health screenings, leading to a delay in diagnosis of preventable conditions. So typically men delay going to get treatment until things get really bad. And then at that point, if there is a diagnosis, let's just say of cancer, is diagnosed at a higher or later stage, and therefore their treatment at that point is more aggressive and the involvement within the body is more aggressive. So tonight we're going to just touch on these topics. One, to raise awareness, to continue the movement of Movember. So if you are one of the men who have joined this movement of No Shave November and you're growing out your beard and your mustaches, share it on our page. We want to see them. We want to encourage early detection and then promote overall wellness for men everywhere, making sure that all the men in our lives get the health care that they need. When we're talking about men's health, it involves more than just the physical health of men. It involves their mental health, as we talked about last week. It involves their emotional well-being, as we talked about as well. And then lifestyle choices like nutrition, exercise, sleep, and stress management. I'm a part of a huge exercise platform, and there are several male instructors. And I'm just amazed at the level on health, not just physical, mental, emotional, all of that. They're very transparent and vulnerable. And I think that's something that a lot of men tend to shy away from. But we have to make sure, and I say this a lot, You can't be healthy if one part of your life is not healthy. It's the whole body. It's the holistic health and it's holistic caring. So if you come and see me as a healthcare provider, we're not just going to take a look at your heart. We're going to look at all the other things. What's going on in your life and your emotions and your spiritual life and your, all of the things, right? Because they're all tied into each other. Maintaining a healthy weight in terms of physical health, maintaining a healthy weight, staying active, eating a balanced diet, staying hydrated are very critical. Just as it is with women, the same holds true for men. These are things that are instrumental to conducing to setting a healthy environment within the body that is conducive to overall health. When it comes to mental health, men face higher rates of depression, anxiety, and suicide. Many times it's not talked about and they don't share their feelings as open as women. And again, this doesn't hold true for all men. It's not a cookie cutter thing, right? But chances are, according to the American Foundation of Suicide, men are 3.5 times more likely to die by suicide than women. Men tend to hold things in and bottle things in, and they aren't, as I mentioned, they aren't as readily open to share what's going on with them. Emotional well-being. There are often societal pressures that are placed on men to be strong and to not show their emotions and not show their vulnerability and all the things. And I feel like as society, we have kind of turned the page on that to some degree, because we have more men now who feel safe with sharing what's going on with them, who feel safe crying and showing their emotions. And I'm not going to put anybody on Front Street, but I have someone that I'm very close to, and I'm grateful for that they're not afraid to share their emotions. And that is just a sign of strength in and of itself. Some key tips for wellness. We'll kind of talk about that. We know we've talked about it several times here in terms of exercise and different things that we can do from a health and wellness standpoint. And while I'm a healthcare provider, I'm also a wellness provider, because I want to make sure that we're looking at things from all aspects, not just from the medical standpoint, but also a wellness standpoint. Meaning, is there something that we can do to help you with your anxiety if medication is not necessarily needed at this point? Meditation, deep breathing, yoga, things of that nature, exercising that release those happy hormones. So while we're in that vein of exercising, I would suggest, right, 150 minutes of moderate intensity exercise each week. So that's 30 minutes, 5 days a week of moderate intensity exercise that helps with overall wellness. Eating a balanced diet that, and I say eat the rainbow, right? So all the good looking, the shiny, the red, greens, yellow, orange fruits and vegetables, the whole grains, the lean meats, the protein. I love a dietary pamphlet or flyer that I was introduced to many years ago when I worked at the hospital, and I was a diabetic educator, unit-based educator. And we would educate our patients on their diet. And it was the My Plate Planner. And it had an 8-inch plate, and it had the plate kind of divided into portions. And half the plate was the leafy greens and the veggies, right? And then a quarter of the plate was the starches. And then the other quarter of the plate was the lean protein. And I typically say the portion of your protein should be able to fit in the palm of your hand. Okay. So if you are eating more than what's in the palm of your hand, typically that's a little bit more than what you should be having. But on average, lean protein and the portion size should be no bigger than the palm of the hand. Sleep, getting at least 7 to 9 hours of quality sleep, uninterrupted sleep. So what comes with that? Setting a sleep hygiene, setting a schedule on things that you can do to make sure that you are well rested and things of that nature. And building strong social connection. So getting outside of the house, getting outside, interacting with, friends and coworkers in a healthy manner, doing things that are healthy for you socially and not isolating yourself. Practicing self-relieving techniques, as I mentioned, meditation, yoga, and then deep breathing exercise. There's several apps that are available. We all have our smartphones, right? And this is like our life in our hands. And there's so many apps that you can download to help with sleep, to help with meditating and deep breathing. There's also I have a Samsung, and there's an app on here that tracks my stress levels when I have on my watch. So there's many different things that we can do that don't take up too much of our time that are helpful in our wellness. Important screenings. We talked about some of the screenings as it related to prostate cancer and testicular cancer, and as well as mental health screenings. But regular health screenings are important, so important, critical to early detection of conditions like cancer, heart disease, diabetes, and some other things as well, right? We talked about the colon cancer screenings, depending on the age, and then the testicular cancer screenings that you'll do on those exams every month. Early detection is key, right? Getting the blood work done, getting the urine screenings to check your urine to see if there's anything going on with the kidneys, getting the physical exams every year. Screenings often detect symptoms of disease, also detect diseases before the symptoms present itself, right? We talked about blood pressure, I think it was last year, and we talked about it being the silent killer. Well, did you know there are many times that issues with your blood pressure can show up in your urine because protein is being leaked in the urine, or you have higher levels of sodium or different things within your urine? Or your blood test shows something that could show that there's an issue with your cholesterol levels, which then could lead to issues with high blood pressure because your cholesterol is elevated. We may see signs of kidney damage because of elevated blood pressure. So there's different things that we look for on blood work that will lead us to determine if there's something else going on. So what screening should men get? We're talking about blood pressure, right? So starting at the age of 18, and actually even earlier than that, when we start out seeing babies and little kids, once they get into school age, we start checking their blood pressure and screening, especially now where we have such a increase in childhood obesity and childhood diabetes. And so we begin to screen for diabetes and blood pressure early. So blood pressure, men should have their blood pressure checked every 2 years. And I kind of disagree with that. I think every year you should get the blood pressure checked, often as possible, especially if you have a family history of high blood pressure or you've had an elevated blood pressure reading. You want to get your blood pressure checked as often as possible. Many of the pharmacies have them. When you go to your doctor's office every year, they should be checking your blood pressure, because I'm a proponent for those annual physical exams and annual wellness exams. We know that high blood pressure can lead to heart disease, stroke, and as I just mentioned, kidney disease and kidney issues. So it's so important that you are checking your blood pressure regularly. Cholesterol. When you're going for your annual exams, physical exams or wellness exams, you should be getting your cholesterol checked with the blood work every year. And that should be fasting, right? Nothing to eat 8 to 12 hours before you have this blood work done. So men 35 years and older, earlier if you're at risk. So if you have a family history of elevated cholesterol, or you have high blood pressure or diabetes or some other disease condition, you will start getting this blood work done pretty earlier. And even now, we're screening earlier, not even at 35, way before that. Whenever you're coming in to get your physical exam, every year you should be having some blood work done. And we're looking for trends to see if things are, beginning to elevate. And it could be slow elevation. But if you look at, let's just say for blood pressure, if we look at someone's blood pressure and it's slowly creeping up, and each year it's creeping up and up and up, we can kind of trend to see where it's going to be in a 5-year mark, right? So we want to do things to help decrease that so the blood pressure isn't elevated. And the same holds true for the cholesterol. We know that high cholesterol can lead to heart disease, and it's that plaque that's developed because of elevated cholesterol levels that lead to heart attacks and high blood pressure and coronary artery disease and peripheral vascular disease and all of those things. Diabetic screenings, again, should be screened every year when you get your physical exam. If you have a family history, of course, you're going to be screened earlier. If there's obesity, you're going to be screened earlier. But the recommendation is yearly when you go in for your physical exam that you should be having this blood work done. When it comes to prostate screening, we talked a little bit about that. And men over the age of 50 should discuss options with their healthcare provider. If you are an individual who is at higher risk, being African American or having a family history, you're going to get screened a lot earlier. When we're speaking of colorectal cancer, the guideline age or the standard age now is 45, where men should get those screenings done. But again, if you have a family history, you're going to get screened earlier. Skin cancer, right? And there's some controversy among certain individuals in terms of skin cancer. So everyone should have a yearly skin exam, right? When you go for your physical exam, your healthcare provider should have you undressed, put on one of those cool little gowns, and they're looking at your back, they're looking at your skin, areas that you can't see. You're having your partner, your husband, your wife, whomever it is, look at your back, kind of look at the skin in areas that you can't see to make sure that there's nothing abnormal or suspected of being a cancerous lesion. Now, everyone, no matter how much melanin you have in your skin or not, we should be getting those annual physical exams, looking at any new moles, any moles that are changing their shape, their size, if there's any abnormal lesions that are popping up. We want to make sure that we're getting screened. Particularly those individuals who are fair skinned are at higher risk, but everyone should be getting screened. Testicular cancer, we talked about that, and we talked about the importance of completing your monthly testicular exams and what that looks like. The ages is between the ages of 15 and 35, where we see the higher incidence of testicular cancer. So it's so important that parents, that we're talking to our young men, our boys, about how to perform these exams, especially if there's a family history, right? And then individuals who use smoking, who use chewing tobacco and, dipping powder and things of that enough, or those things are snuff. I don't think I've seen anybody dip snuff in a long time, but it's still out there. They're at a higher risk for developing testicular cancer. And so it's important that we're getting screened. How often should you be screened? I've been asked on certain things, depending on your history, if you have any risk factors, if you have a family history. If not, we're following the normal guidelines, right? And you can have those conversations with your healthcare provider. And I will post some things on our page to make sure that you are aware when you should be getting those screenings. Hormonal changes in men. Just like women go through menopause, men go through andropause, and that's when those hormone levels begin to dip and drop off, and men begin to gain weight, and they lose their muscular tone, and they begin to lose hair, and they start getting the beer belly, and they don't even drink beer. All of those things, right? So we have to pay attention to hormonal changes in men as well. For men, testosterone is the key hormone that affects everything from the muscle mass to mood to energy to libido. And when the testosterone levels decrease, so do all of those things, and it impacts the men in all of those areas. Just as when estrogen decreases for women, we have some of the same issues. Testosterone normally naturally declines about 1% each year after the age of 30. So once a man hits 30, 1% each year, those testosterone levels begin to decrease. And while this is normal, some men experience a drastic drop, right? Leading to low testosterone, which can severely and majorly impact their quality of life. So I've recently fell in love with functional medicine, and I see a functional medicine nurse practitioner, and I'm such an advocate and proponent for that because it changed my life, and I've watched other people's lives being changed utilizing functional medicine and some of the bioidentical hormones. And so something to think about. So some of the common hormonal issues that men face, we talked about the low testosterone, but what does that look like? Symptoms of low testosterone include fatigue, depression, low sex drive, difficulty concentrating, low libido, and it's most of the time it's really undiagnosed or underdiagnosed, right? Some healthcare providers chuck it up to, oh, it's just you're aging or, you're stressed. No, we need to dive deep and figure out what's going on. Around 2 to 4 million men in the United States suffer from low testosterone. And this condition does increase with age. So men over the age of 60 are at higher risk, but we are seeing that at earlier ages now. We're seeing it much earlier in some men, some as early as their late 20s. We're seeing drastic drops in testosterone levels, and it's impacting their work, their family, their social life. All around, it's impactful to them in a negative way, and we need to be able to do something to help that individual. Treatment options include testosterone replacement or TRT, but it's essential to discuss the risk with your healthcare provider. And not all men are candidates for testosterone. So you have to make sure that you're getting a really good evaluation. We talked about andropause, and this is where the testosterone levels begin to decline, and men experience symptoms similar to menopause, right? They get the hot flashes, the mood swings, and then the reduced libido. I can tell you, menopause is not fun. It is not fun. And I have witnessed men in andropause, and some individuals call it the midlife crisis. They don't know what's going on with their bodies. And many times it's not diagnosed properly, or it's underdiagnosed, that these men suffer and don't know what's going on. These symptoms, again, as I mentioned, can interfere with their daily life, their relationships. They have issues remembering things. Their stamina is not what it used to be. And it can really impact their psychological state as well. So it's important to address that and to have support, not only from a medical standpoint, but from family as well. So some of the other hormonal issues and problems that men may face are thyroid problems. So that's why it's so important to get your thyroid levels checked yearly when you have your blood work done. Hypothyroidism can, again, affect energy levels, weight, and mood. So you can see how it may be underdiagnosed. So a man may come in and report some of these symptoms, and the first thing is, oh, we're going to look at the thyroid. Well, the thyroid levels are normal. It must be something else. Well, we need to look at something else, and that's looking at the testosterone levels to figure out if this man is suffering from low testosterone. And then cortisol, the stress hormone. Chronic stress can lead to elevated cortisol levels, which impacts an individual's ability to sleep, their metabolism, and then their immune function. So when someone is constantly stressed, they're at risk for being sick because their immune system is being worn down. So we have to take care of ourselves, men. You have to take care of yourself. Women, we have to make sure that the men in our lives are taking care of themselves. And if they're not making the appointments, then we're nagging them and we're making sure that they do. So some of the warning signs to look out for, key warning signs, early warning signs, and we kind of talked about some of these previously, but unexplained weight loss or weight gain. Unexplained weight loss could indicate that there's a metabolic disorder. There may be some cancerous processes going on. Weight gain, there could be some issues with the thyroid or some other things in terms of metabolism going on, metabolic syndrome and things of that nature. Chest pain or discomfort could be signs of heart disease. Don't ignore it. I can remember a colleague, she and I met at a function, and she was explaining something about a family member of hers who was complaining of back pain, and they were treating it. And I may not be telling the story to the fullest of all the details. One, because I don't want to divulge too much about this individual, and then two, I don't remember all of the details. I remember some, but this individual was, I believe, having some back pain or jaw pain or something to that nature, and they were just checking it off to muscular pain. That individual went to the hospital and was helicoptered to one of the major hospitals that had open heart surgery, like immediately once they went to the hospital. I'm so glad that they did. So if you're having chest pain, chest discomfort, do not ignore it. Changes in bathroom habits. So urinary frequency, pain, blood in the urine could be a sign of prostate or kidney issues. Urgency, frequency, hesitancy when you go to the restroom, men, if it takes a long time for you to get the urine stream started. And if you do, if it's a weak urine stream, or if it starts and stop, there's something that's going on there and you need to get that checked out. Frequency of urination, like every 20, 30, 40 minutes, you're having to go and pee. There's something going on, unless you're drinking a lot of water, right? So we really have to look at it and take things in perspective. Persistent headaches, blurred vision, dizziness could be a sign of hypertension, high blood pressure, or neurological issues. I can remember a young patient that came into us through ER when I worked in the ER, and he had this nagging headache for 2 weeks. And he just thought, I'm stressed and, working a lot. This individual was suffering from a brain aneurysm. And had he not come in to be evaluated when he did, it could have been catastrophic for him. He underwent surgery, had to go through a lot of physical therapy and rehab, but he came out doing very well. So I'm so grateful that he listened. We have to listen to our bodies. You know your body. Know when something's not right. Know when something's off. Be in a place where you can advocate for yourself because you know what is normal for you and what's not. Difficulty sleeping could be an indication of stress, depression, or sleep apnea. Another thing, sleep apnea. If you're an individual that snores, you should be getting evaluated for sleep apnea, because if you're not breathing while you're sleeping, you're decreasing your oxygen, which is decreasing the oxygen to your brain, decreasing the red blood cell, the oxygen that's circulating in the red blood cells, and it begins to impact the body overall. Not only is it disturbing your partner or your spouse, but it's causing problems with you. So pain or discomfort during sex could be issues such as erectile dysfunction or low testosterone. So, or it could be some other issues going on. There's some different conditions of the penis and the penile gland that could be causing some issues. So just make sure that you're paying attention to that. And get into a place where you're comfortable talking to your healthcare provider about anything that's going on with your body. We want you to be honest and we want you to be comfortable when you come to see us. And it's so important. So when we talk about different ethics and the differences, we know that African-American men are at a higher rate for certain conditions such as prostate cancer, high blood pressure, things of that nature, and diabetes. Hispanic men tend to face challenges related to access to health care and delayed diagnosis of diabetes and cancer, and then are at higher rates for obesity-related diseases. Asian men, while they tend to have lower rates of obesity, they have higher risk for metabolic syndrome and face underdiagnosis of mental health issues. And then when we speak of our white counterparts, they tend to have higher incidence of melanoma and are more likely to seek health care at later stages, particularly for conditions related to colorectal cancer. I just want to say tonight, thank you so much for listening into this. And I know I covered a lot, but I wanted to make sure that I highlight some of the key things that are crucial to making sure that our men are getting the screening that they need. We have to make sure that you're being proactive, that you're taking care of your body, that you know your body, that you know your mind, and that you know when things are shifting with your mood. Don't wait until the symptoms appear. If you happen to notice something, get in quickly and get seen, right? Crucial. It's so crucial to get those regular health screenings and to watch out for any warning signs. Again, seek help if you need. Don't be afraid to ask questions. Find someone that you are comfortable with, where you can talk about any and everything that's occurring within your body, and that you are feeling validated and that you're able to advocate for yourself. I'm just so grateful tonight that I can be here to educate you guys and provide you all with this knowledge. If you're due for a screening or have been avoiding a healthcare checkup, take this as your sign to make an appointment. You can make an appointment with us on our website, Wells Legacy Health and Wellness, or wellslegacyhealth.com. You can give us a call, 321-306-6755. This is your call to action. If you have not gotten your healthcare screening, make that appointment. If you don't have a healthcare provider, give us a call. We'll get you in. We'll make sure we get you taken care of. Okay? What's the one thing that you're doing this week to improve your health? Let us know in our comments. Let us know on our page. What are you doing? One thing you're doing this week to take care of your health. What am I doing? I'm exercising. I'm in the midst of a plank challenge where I think we're up to 3 minutes and 20 seconds. Have to hold a plank for 3 minutes and 20 seconds. I did it this morning. I actually did 3 minutes and 30 seconds because I thought we were at that point. So tomorrow I have to do 3 minutes and 30 seconds. But each day we increase by 10 seconds until we get to 5 minutes. So we've made it to the 3 minute and 20 second mark. What is something else that I'm doing to improve my health? Moving my body each and every day. So what are you doing? One thing that you're doing to improve your health. This has been Dr. Latoya Wells with Wells Legacy Health and Wellness for another episode of Wellness Wednesday with Dr. Wells. Stay safe and be well. Until next time, have a good evening. Bye-bye.